Okay, so let's talk about the developmental aspects of the reproductive system. First off, gender determination, and that is determined by the male. See, the gender is determined by whether or not there is an X chromosome or a Y chromosome present. Every child has two chromosomes, one it gets from mom, one it gets from dad. Women have two X chromosomes, so they're always going to give an X. But men have an X and a Y. And so if the dad gives an X chromosome, then you're going to have a girl. If it gives a Y chromosome, then you're going to have a boy. So there's about a 50-50 chance. There's slight differences in that. There are more males that are born. That comes from the fact that the Y chromosome is slightly lighter, and so those sperm are slightly lighter, so they swim just a little bit faster. But the Y chromosome also results in a weaker immune system, so the number of males after the first year is approximately the same as the number of females. There's actually a few less males than females because of illness. So in the end, it still comes out close to a 50-50 mix. Other things that come into play, first off, the gonads do not begin to form until the 8th week. So until then, you could not differentiate between a male or a female. And it is the presence of testosterone when the Y chromosome kicks in that results in a male fetus being born. The thing there is that certain structures are already developed which serve no use in males but do serve use in females. For instance, nipples. So men are born with nipples because they begin to develop prior to this 8th week of pregnancy, before the presence of the testosterone. And so testosterone is not produced until the gonads form. Now, developmental aspects of the reproductive system. Hang on here. Reproductive system organs do not function until puberty. We see puberty, which usually begins between the ages of 10 and 15, depending on a variety of environmental factors and genetic factors that come into play. It begins earlier. It can begin earlier and is happening earlier in females due to exogenous estrogens. When we talk about exogenous estrogens, we're talking about environmental estrogens that can come into play. So we see, for instance, the women taking the pill, they pee into the water supply goes downstream. Even though the water is cleaned up, it still has these estrogens which get into the drinking supply, which can result in earlier onset of puberty. Now, let's see here. This is mostly a joke, but what we've got here is very early onset puberty in a male. Now, males. Some of the developmental aspects. What you see is enlargement of the testes and scrotum, which signal onset of puberty. Generally around the age of 13, they begin to develop body and facial hair. And male development is delayed a little bit compared to female development. So males tend to have larger bodies than females. With females, we see it as budding of breasts, signaling puberty, often around the age of 11. Body hair, and in this case, it's not like the body hair in men, which can be covering the chest, the face, the whole body. We see body hair forming in the pubic region and axillary or armpit regions more than anything. and menarche, which is the first menstrual period which occurs. Some of the secondary sexual characteristics, and these are things that some people think of as primary sexual characteristics, but the fact is breast formation in females, that's a secondary sexual characteristic. It is not directly associated with childbirth. So the things that are associated with childbirth are the primary sexual characteristics, and those are development of the ovaries, development of the uterus, and so forth. And in males, the development of the testes. So with females, breast formation, widening of the pelvic girdle, which occurs during puberty, and the development of body hair. In males, it's facial and body hair. Deepening of the voice. Again, men develop a little bit later, so there's more time for the Adam's apple or the larynx to develop, so we tend to have a deeper voice. And widening of the pectoral girdle or the chest area. Now, other developments, menopause. This is later in life, and that's where a woman has gone a whole year without having a period. Ovaries stop functioning as endocrine organs, so they are no longer producing the estrogens, progesterone, etc. Childbearing ability ends. As a result of this decrease in the estrogens, this is when we see women start to develop mustaches, for instance. There is no equivalent of menopause in males, but there is just a steady decline in testosterone. So for females, it goes from up here to a rather rapid drop. With men, it's just sort of a slow, steady decline over time in terms of their testosterone levels. So this means that men in their 60s and 70s become generally less aggressive, less alpha male, less, well, I'm not sure what else you could say, but generally men who have been terrible parents can become very great grandparents just because they have lost some of this aggressive behavior that we see caused by the presence of testosterone. Now, closer look at contraception. And there are lots of different methods. I should tell you that the most effective method is abstinence, but that is not realistic or practical. You just can't expect someone to not have sex at all. So there are other methods that exist. There are hormonal methods, such as the pill. We have IUDs, which tricks the body into thinking it's pregnant. We have barrier methods like diaphragms and cervical caps and condoms. There's sterilization and other methods, including spermicidal foams, gels, sponges, coitus interruptus, the rhythm method. And we're going to talk about a few of these. First off, let's look at contraception, which is just birth control, preventing having a baby in the first place. Now, typically, if you've gone without protection for a period of a couple of years and you haven't had a baby, then there is a good chance that there is some fertility issue associated with that. So the odds of becoming pregnant are actually fairly high without some sort of protection. So birth control pill, which is the most used contraceptive and relies on the woman taking the pill at a prescribed period of time and being consistent about it. So this causes a relative constant supply of ovarian hormones from the pill, which convince the body that you are pregnant. As a result, ovarian follicles do not mature, ovulation ceases, menstrual flow is reduced. There's also a morning after pill, sometimes referred to MAP or Plan B, levonorgestrel, which, if taken within 3 days of unprotected intercourse, will disrupt the hormonal signals to the point that fertilization is prevented. Again, we are convincing the body that you're already pregnant. This is used quite often when there is some sexual contact that was unexpected, and as a means of blocking the potential pregnancy that occurs. Other hormonal birth devices can cause a thickening of cervical mucus, which means that the sperm are unable to swim to fertilize the egg. And this includes the mini pill, which is a tablet form, and Norplant, with rods that are placed under the skin and release a fairly constant level of mucus, or constant level of hormones. Now, IUDs are intrauterine devices. These are plastic or metal devices that are inserted into the uterus. They convince the body that it's already pregnant, and as a result, the body doesn't want to be pregnant with two children, so it prevents the implantation of the egg if there is a secondary egg that's fertilized. So technically, with an IUD, you can have a fertilized egg, it just can't implant. Then there's sterilization, and there's a couple of different types. For females, there's tubal ligation, where you cut or cauterize the uterine tubes. This prevents the, also the fallopian tubes is another term for the uterine tubes. This prevents the egg from coming down through the fallopian tubes and being united with the sperm. And then there's a vasectomy for males, where we cut or cauterize the ductus deferens, and this results in no sperm being able to be deposited into the semen. Now, there are problems associated with each of these. The tubal ligation on a female is harder to reverse. So if you were to have this done at a young age and decided later on in life that you wanted to have a child, that might be very difficult. They can attempt to reverse, but it is not likely to work. With a vasectomy, it is a reversible procedure. It is not 100% reversible, but in this case, you cut or cauterize the ductus deferens. There is a problem with this procedure in that it can sometimes automatically reverse on its own. See, they take the ductus deferens and they cut it, and then they fold it back and tie off each end. And sometimes that can come untied, and these can spring back in place and reapproximate, and you end up having, once again, the ability for sperm to go into the semen. This happened to a professor of mine. He had a vasectomy, and then about a year later, his wife got pregnant. Obviously, they had some conversations about what had possibly happened, but in the end, what had occurred was just that his tubes had, or his vas deferens had reunited and resulted in sperm. So he had a more significant vasectomy done at a later date, where he actually had them cut out a chunk and cauterize both ends to make sure that there was not a chance of having another baby. This is the point where we're going to stop here, and we will pick up on contraception and additional issues in our next presentation.